You may or may not have ever been picked up and spent time in an ambulance. Of course, it's not a great experience to have to be in that position, but there's a new opportunity here in Michigan and also some of our surrounding states where if you or a loved one, someone you know, is dealing with some sort of a mental health crisis, there's now a specialized vehicle that may be available that's a little more calming, a little more gentle than maybe your typical ambulance experience. Life EMS's ambulance's behavioral health transport program is seeing some pretty tremendous success in communities here in West Michigan and beyond. It uses specialized vehicles for those in mental health crisis to safely get them where they need to go to receive help. I'm joined once again here on Evening Plus by Stephanie Raleigh with Life EMS. Stephanie, thanks so much for joining us once again. I think this is a really unique program that has done really well since it launched a couple of years ago, but maybe folks haven't heard of it just yet. Tell me kind of how this different transport program works.
Right, and thanks for having me and us, Julia. This actually it came out of an idea through multiple different factors playing into it. Around 2018, a conversation started about how can we look at this opportunity in the behavioral health healthcare community and focus on these individuals and really make sure that we're providing the most appropriate, dignified transport for them using the most reasonable means. So in 2022, we started the program. We upfitted SUVs, started with one with partitions, has an onboard camera, so there's live streaming to the front of the car. So our specialist, who's trained by Pine Rest, in our partnership with them to build the car and develop the training program, can keep an eye on the person in the back seat while they're traveling in a vehicle, not on a stretcher, like you said, in an ambulance. More appropriate type of transport and more comfortable. And our specialists are trained to, identify escalations, and then they have the tools to de-escalate and really personalize that transport for the success.
Yeah, and I don't want to discount at all of the work that paramedics and EMTs do to keep a traditional ambulance and stretcher experience as calm as possible. But, when someone's recovering from a car crash versus having some sort of a mental health crisis, it's two very different scenarios that a little bit of a different setup, is just better for. I want to kind of phrase it that way. And we've got some pictures of what the inside of that vehicle looks like that we can show. Looks like an SUV on the outside, but then inside you'll see in a moment what this was looking like. And so this is not brand new, started a couple of years ago. You guys started with one vehicle, you're now up to 9, hopefully 10 very soon.
Correct.
And this is not just a West Michigan thing. You guys travel pretty expansively with this program.
Right, Life EMS covers 11 counties now in Southwest Michigan, but this program isn't confined to those 11 counties. We're oftentimes, multiple times through the day, taking people, driving people, transporting people over to Detroit, down to Indianapolis, up to the UP, wherever the need is and wherever that care is and that bed's available, that's where we'll go.
Yeah, and while you could potentially have someone who's also trained as a paramedic or EMT, in one of these vehicles, they sort of have their own title for the folks who are driving these folks to where they need to go. Tell us about that.
So we like to refer to the folks that are involved in this program as specialists.
Yeah.
They're specially trained to work with folks that are in crisis, and like I said earlier, through that training, work with them to make sure that it's a nice, safe environment and dignified transport. So we refer to them as specialists.
Yeah.
They are all associates, and like you say, they come from many different backgrounds. They could be paramedics, EMTs, control center, associates, anybody that's interested within Life EMS and externally too, in really working closely with the behavioral healthcare system and with these individuals is welcome to participate in this program.
And at this point, you guys have offered roughly 7,000 rides, which is a huge number to think about. What can you share with us just about the experiences for, both the specialists that are driving these vehicles and taking care of these people, but also the patients inside, how this has improved the experience for folks in this specific scenario?
Right. And through the 7,000 transports that we've done, we've developed really good relationships with not only sending facilities, being emergency departments primarily, but also the receiving facilities. The two local facilities here that most common to people, Pine Rest and Forest View, both have said that when people arrive with our specialists in this type of transport, arrive in a better demeanor. The transfer into the facility is much smoother, and arguably there is a a belief that we're looking into that the length of stay is actually shortened. So overall, a better experience for that person on their journey through this time.
And how does this work as far as, someone may call 911, of course, for a multitude of many different reasons. How does it work that you would have this vehicle transport you versus, an ambulance or a police car or what have you?
So right now, this program is exclusively for individuals who have been medically cleared. So it's not in the 911 system at this time.
Gotcha.
So medically cleared can physically get in and out of a car. And that's where we step in and we'll work with the sending facility or whoever the requester is to make sure the person is prepared properly for the transport, is aware of the transport, and then we take our time to make sure we develop that trust and rapport with the person to end up in a successful transport and a memorable one actually for the person too.
Yeah, I'm sure, just the starting off in that crisis mode and having that be smooth from the get-go and getting to where that person needs to be to get whatever care they need, starting things off on a really, respectful, dignified, careful basis, I'm sure is so helpful and comforting for people.
And to be honest, we've since 2022, 7,000 transports. We have seen some individuals a second time, and we always hear, I'm so glad that you're here, appreciated it before, looking forward to the transport. So it's a really positive experience on so many levels.
Yeah, and of course the kind of moving forward news at this point, you guys have 9 vehicles through Life EMS, hoping to launch a 10th, and you started with just 1, which is great to see, that growth and being able to serve more people. Anything else I'm leaving out? Anything else to know for folks at home, when they're hearing about this?
We transport people of all ages. Our partnership with Pine Rest has really led to our success. We've learned from their decades of experience around transporting and working with people in crisis, and that's really enabled our specialists to be as effective as they are and make us truly the gold standard that BHT is all about.
Awesome. Stephanie, thanks so much for coming on the show again. I really appreciate it. Some really important news here to share. Success of this program is only, ensuring to help more people in our community, which is great. So thanks so much for coming on again.